Hi everyone, this is Dr. Rajini, Gynecologist, Laparoscopic Surgeon from Care Hospital, Banjara Hills. So these days we see a lot of girls, ladies coming to our OPD with chief complaint of irregular periods. What is a normal period when we talk about it? During a normal period, a cycle length, women will bleed once in 28 to 35 days. That is a normal menstrual cycle length. But in few girls or ladies, these cycles could be extended to 40 days, or it can be extended to 2 months, once in 2 months or once in 6 months, and it can be erratic, or it can be very irregular, that polymenorrhea they can get once in 15 days or so. So lots of girls, they keep worrying and asking us, what is the problem? Do we have to worry about it? Yes, definitely it's a matter of concern. For a woman to get a normal menstrual period, a lot of things happen in the body, like a brain sends signals to our pituitary gland, and from those pituitary gland it makes the ovary to release few hormones like estrogen and progesterone, which maintain this menstrual cycle. In irregular periods, this hormonal balance is lost. So the most common reasons for these irregular cycles are obesity. See, when the girls, younger age girls, they become obese or so, it leads to irregularity of periods because of this irregular hormonal imbalance. And the other reasons are like having hypothyroid or hyperthyroid. Hormonal imbalances like thyroid, if it is high levels or low levels, are also definitely going to affect your menstrual cycles. Apart from this, stress, it could be your work stress or your exam stress or any kind of stress, and not sleeping properly. This is one of the major reasons which we see because our cycle, our daily activities, we have a diurnal variation of hormonal release. When this cycle is disturbed, definitely it leads to irregularity of the periods. And in reproductive age group girls, most common cause for this amenorrhea, sometimes they miss their period, they think it is a regular period, but actually they could be pregnant also. So it is important that they get tested go for a pregnancy test. So whenever you are facing these irregular periods, definitely meet your gynecologist, get all the necessary investigations done and get treatment accordingly. So what happens if we don't treat these irregular periods? If we are not treating these irregular periods, or the women who have these irregular periods, they have a problem called anovulation. That is, the egg won't be releasing. So if the egg is not releasing, then it may lead to infertility issues. And if the irregularity, amenorrhea, continues for a long time, there is increased estrogen production and reduced progesterone levels. So because of this increased estrogen, it may lead to endometrial hyperplasia, and later in future can lead to endometrial carcinomas. And because of this anovulation, the estrogen levels are so much disturbed, sometimes they may lead to osteoporosis also later in life. So it is always good to get yourself evaluated for the irregular periods and take treatment appropriately on time, so that all the complications related to irregular periods can be treated on time. Thank you.